So what is a FaceTite procedure? FaceTite is a minimally invasive surgical procedure which targets the loose skin or wrinkles over the face and the neck area. So it involves a special electrode and a machine which is US FDA approved. There is an electrode which goes inside the skin and emits the radio frequency energy and tightens the skin, and it also involves the liposuction. So it is a minimally invasive because there are no cuts involved and the results are promising. So FaceTite, it has a special electrode that goes inside the skin and emits the radio frequency energy, and it acts at the two levels. At a deeper level, it causes lipocoagulation, which melts the fat and removes the fat, especially in cases of chubby cheeks and the neck area. It can remove the fat, and it also causes the tightening of the fibrous network in our skin. It causes the skin upliftment, and at the superficial level, at the dermis, it causes new collagen formation and the skin tightening. What is the difference between the surgical and non-surgical facelift? In surgical facelift, which is the traditional facelift, there is a long cut involved, there is the incision is given, stitches is given, and there are chances of complication to the facial nerve, important structures are there, and the downtime is 3 to 4 weeks. But in non-surgical FaceTite procedure, these complications are avoided. The downtime is just 2 to 5 days, and there are no cuts involved, there are no stitches involved, and the results are equally good if the client is selected properly. In non-surgical facelift, we combine FaceTite procedure with other treatments for the face, especially fat grafting to the face, PRP treatment to the face, and Morpheus microneedling treatment. So we custom the treatment according to the demand of the patient, condition of the facial skin. We can combine 2 or 3 procedures together to give a better result.
So we are planning the Aquatite on this area for the lower eyelids and similarly for the upper eyelids. And this is the nasolabial fold. So we do FaceTite just lateral to the nasolabial fold. If we do fillers, we fill this area, and if we do skin tightening, we do lateral to this area so that this area becomes lifted. And I'm marking the mandible. So we'll be always lateral to the pre-jowl sulcus. So I'm marking her jowl area. This is for the neck. I'm marking the muscle, sternocleidomastoid. So we will remain medial to this. Similarly, I'll mark the bone, then the sulcus, and the jowl area. So there is some fat over the platysmal bands, so we will suck out this fat and also lipocoagulate, and we will use the FaceTite probe to make the skin and the jawline more defined. And after the Aquatite or FaceTite, we'll do the Morpheus treatment, 2 passes on the whole face. For the upper lip, for the forehead and the chin area, we will use only Morpheus, and for just lateral to nasolabial folds, lower eyelid, jawline and the neck, we will use Ecotite and the FaceTite. Thank you.
So what are the different areas that can be treated by the FaceTite? So as you can see in the picture, we can start from the upper eyelid and the lower eyelid. There can be deposition of the fat and laxity of the skin that can be treated by the FaceTite, even the temples area. Then we can lift the cheeks, as in the facelift we can lift the cheeks, the nasolabial folds and the jawline contouring. That is very important to give definition to jawline. And the jowl area we can do micro liposuction and the FaceTite procedure. Similarly for the neck area, if there is deposition of the fat and skin laxity, that can be treated. And in difficult areas like the upper lip and the forehead, we combine the FaceTite procedure with the Morpheus treatment or sometimes with the nano fat grafting. Thank you.